Welcome back. In this micro lecture, I would like to discuss anxiety disorders. I will present some of the medications that are used to treat these disorders. Moreover, I will present symptoms of common medical conditions that may masquerade as psychiatric disorder. I will also discuss drugs that can manifest similar symptoms. Symptoms of anxiety: initial insomnia, feelings of unreality or derealization, impaired attention and concentration, shakiness, restlessness, to include nervousness and edginess or physical tension. These clients worry, but what really makes it into a diagnosis is the fact that they cannot control their fears and worriness. Always, what if? What if I get fired? What if my check bounces, etc.? Drugs that may cause anxiety are the amphetamines, appetite suppressants, asthma medications such as albuterol, caffeine, cocaine, nasal decongestant, stimulants, and also steroids. Common disorders that may cause anxiety are coronary insufficiency, hyperthyroidism, post-concussion syndrome, cardiac arrhythmias, Cushing's disease, alcoholism, and delirium. Now, when do we prescribe anti-anxiety medications? Well, treatment differs depending on the diagnosis, so each disorder will need to be addressed separately. As for example, for general anxiety disorder, many physicians have tried to treat this disorder with benzodiazepines. This, of course, presents two problems. And the first one is that benzodiazepines can cause depression in some individuals. And number two, the patient can develop tolerance dependence problems with chronic benzodiazepine use. Many clinicians think that general anxiety disorder is primarily a psychological and not biological, and recommend only psychotherapy. Nevertheless, SSRIs, venlafaxine, and buspirone, to be specific, buspirone hydrochloride, have been shown to be effective in treating general anxiety disorder. Now, an added feature of this medication is that patients that do not develop dependence or tolerance, stress-related disorders. The prescribing psychiatrist may use tranquilizers because they are extremely helpful reducing anxiety symptoms, especially insomnia or restlessness, which accompany acute situational stress. The most important issue to consider is whether or not the stress is acute and likely to be of short duration. Anti-anxiety medications should only be used for a period of 1 to 4 weeks. Panic disorders. One isolated panic attack is generally insufficient evidence of true panic disorder. Nevertheless, 4 or more true attacks within a period of 1 month suggest panic disorder. Look for spontaneous attacks and episodes that last a matter of minutes. Many patients with other type of disorders say they have panic attacks, but on a close inspection, many do not meet the criteria for the DSM-5. There are several options, including buspirone. Unlike the benzodiazepines, buspirone is slow acting. It often requires 2 to 6 weeks of treatments before symptoms are improved. The major problem encountered with this medication is premature discontinuation by the patient. Patients often expect quick results from medications. It is important to educate the client about the onset of action. Buspirone can certainly be effective in treating many symptoms of general anxiety disorder, but please remember that buspirone does not seem to decrease panic attacks. Buspirone must be taken every day. It is not a medication that is taken only when the patient feels anxious. A selective serotonin reuptake inhibitor or venlafaxine may also be beneficial in treating general anxiety disorder. Again, treatment requires 2 to 6 weeks before signs of symptomatic improvement emerge. If the patient fails to respond to buspirone, venlafaxine, or SSRI symptoms, if they become severe, and if there is no history of alcohol or other substance abuse, benzodiazepines can be used to treat general anxiety disorder. Anti-anxiety medication. For general anxiety disorder, buspirone or an SSRI, the usual dose is normally between 5 to 40 milligram. Half-life is approximately 2 to 8 hours. For stress-related anxiety, diazepam is helpful, and it is normally prescribed between 5 to 40 milligrams. Clonazepam at 0.5 to 4 milligrams, and lorazepam, it's another medication that it is also used and normally prescribed between 2 to 6 milligrams. For the treatment of panic disorder, alprazolam is helpful and normally prescribed at 0.25 to 8 milligrams. Patients need to be informed not to consume alcohol with this drug because side effects may be deleterious to the client's health. Now, diazepam. Among the benzodiazepines, diazepam is the most lipophilic, and thus it crosses the blood-brain barrier rapidly. This may account for its reinforcing properties, and therefore it is likely to be abused. Alprazolam and lorazepam are less lipophilic compared with diazepam. However, they are highly potent benzodiazepines and are associated with potential abuse. Now, social phobia. Propranolol, also known as Inderal, are normally prescribed at 20 to 80 milligrams. Venlafaxine could also be used, and a monoamine oxidase inhibitor could also be used in the treatment of social phobia. The prescribing psychiatrist may consider using phenelcine, also known as Nardil. This medication is normally prescribed between 30 to 90 milligrams, and sedation is low. Dopamine and serotonergic levels are average. Clonazepam, also known by brand Klonopin, at 0.5 milligram to 4 milligrams for the treatment of panic disorder. It is imperative to remember that clonazepam has the longest half-life among the high-potency benzodiazepines. Other high-potency benzodiazepines are lorazepam, alprazolam, and triazolam. Temazepam is the low-potency benzodiazepine with short half-life, whereas diazepam is a low-potency benzodiazepine with a long half-life. Now, in reference to alprazolam, an abrupt discontinuation may produce withdrawal symptoms that include life-threatening seizure. Alprazolam has a very short half-life when compared with other benzodiazepines. Now, other drugs listed in your textbook may have long half-life and have little risk of withdrawal symptoms. Key points to communicate to your patients. All patients meeting the diagnosis criteria for general anxiety disorder. Caffeine use should be 0. And regular exercise is a very highly yield intervention. Now, in terms of general anxiety disorder, if buspirone or venlafaxine or an SSRI are prescribed, you should expect that it will take 2 to 6 weeks to notice symptomatic improvements. Daily doses, of course, are required. Again, this is not a medication to be taken just as needed. Sometimes medication treatments are not enough, and psychotherapy, stress management, relaxation training, regular exercise biofeedback, of course, are helpful adjuncts to medical treatment. Do not abruptly discontinue minor tranquilizers, especially if they have been taken for several weeks. Sudden discontinuation can result in withdrawal symptoms, which are identical to symptoms of anxiety. Do not drink any kind of alcohol when taking minor tranquilizers. This, of course, needs to be embedded in the client's mind. This is a strong evidence that panic disorder is a biochemical dysfunction, not a psychological disorder. It can often be phenomenally successfully treated with medications. If the client is treated with an SSRI or an MAOI to ameliorate the symptoms of panic disorder, well, it will take approximately 2 to 4 weeks before you notice symptomatic changes. On a final note, if alprazolam, lorazepam, or clonazepam are used, the medication should never be abruptly discontinued. The prescribing psychiatrist will need to reduce the medication gradually, and the standard of care would be to generally lower the medication from 0.25 to 0.5 per day per week. Thank you.